Hey everybody, it's Dr. Daniel here from the Neuropathy Clinic at PhyxMe, and what I'm going to talk about today is prediabetes. And so, as I very often say in the office, prediabetes, it would be similar to somebody saying, hey, I'm kind of pregnant. You either are pregnant or you're not. And so when we talk about prediabetes is just early onset, or rather early stage diabetes. And specifically, obviously, I'm talking about type 2 diabetes. Type 2 diabetes is not technically a disease process because it's reversible and it's curable, contrary to what medicine would have you believe. Medicine wants to manage the process. Medicine wants to just kind of, hey, you're okay as long as your A1C is under 6.0, which is also incorrect. We really should be working to get our A1Cs under 5.5. The reason why I say this is because very often I'll see people who are over 5.5 with neuropathy. And well, neuropathy is secondary to type 2 diabetes because of a whole cascade of events. I don't need to go into it right now. I've talked about it very frequently. But if you're in a situation where your A1C is over 6, then your body is experiencing an inflammatory reaction all the time. Your body's on fire, specifically your gut and your digestive system. And if that system's on fire, then nothing else can work appropriately because the gut is the primary mediator, meaning it controls the inflammatory or the anti-inflammatory processes in the body. And if it's on fire, it can't put any of the other fires out. And that would be issues with our brain function as well. Many of you probably already know that Alzheimer's can be secondary to something called type 3 diabetes, which is diabetes effect upon the brain, and insulin resistance and all of the other lovely things that go along with that. And medicine wants to manage these problems. They don't want to solve them for some reason. And type 2 diabetes, this is a review of another video, type 2 diabetes used to be called sugar diabetes. Why do they call it sugar diabetes? Well, because it's from eating too much processed sugar. And you don't have to think like just sugar. Any sort of processed foods is high in sugar. And even if we eat a ton of fruit or fruit juices, that can also spike sugar. Less likely, but it can still happen. And so there are things that need to be done and should be done. I was speaking with one patient, one of my virtual patients, online patients, the other day, and actually it was the daughter, and their endocrinologist had told them, the family, that blood sugar of around 140 is okay as we age, as we get older. What? It's like the dumbest thing I've ever heard. Almost as if that endocrinologist is trying to ensure that he always has somebody to treat. I can't think of any other reason. And certainly that's going to cause other problems. So we don't want to manage conditions. We want to solve conditions, especially if they're lifestyle-related diseases leading to metabolic inflammation. And so that whole umbrella of metabolic conditions, autoimmune disorders, rheumatoid arthritis, gout, fibromyalgia, ulcerative colitis, Crohn's, celiac disease. There are a bunch of them. That's all secondary to lifestyle choices. And medicine wants to avoid putting any responsibility on the patient for taking care of their health, which is the opposite. It should be, I'm pointing the finger at you, it should be your responsibility to take care of you. Now, yes, if you need guidance, that appropriate guidance should be provided. Medicine no longer does that. They just want to write the scripts and say, hey, just manage, manage, manage. And that goes for blood pressure as well. That goes for cardiac issues. Even cancer is related to metabolic inflammation. All of these things, and I'm not saying you can cure cancer, but you certainly can do things to prevent it or reduce the likelihood that you're going to experience it, for sure. And so that has to do with what we eat, how we live, our activity level, all these basic things that we know about, but maybe don't know the specifics. And again, it's not rocket science. I talked about this in just another video. If you're looking to solve a problem, Go find somebody who solved the problem before. And so whether we're talking about neuropathy or we're talking about reversing type 2 diabetes, that's something that we have a lot of experience with. That's something that we learned from somebody else first, somebody who'd been doing successful for over a decade. And then we implemented those programs and protocols and then added to those programs and protocols. And like we are expanding. So at first we were just dealing with neuropathy, and now we're focusing more on type 2 diabetes. I want to get to that problem before it causes other problems. And so that even leads to strokes and heart disease. So if you can fix the metabolic issue associated with type 2 diabetes, you're going to avoid a lot of other problems. You're going to reduce your risk of experiencing a lot of other problems. So if you've been going through the medical system and there's never been a plan for you to reduce your medications, get off those medications, and you only see yourself adding more medications, you're not being managed appropriately, especially if it's metabolic diseases. So heart disease, stroke, type 2 diabetes, right? All of those are metabolic issues. Rheumatoid arthritis, all of those metabolic disorders. Disorders that can be treated by changing behaviors, by supplementing, not forever, but supplementing to support the body till it recovers this natural healing ability. So if you'd like help, you have questions, you want to learn more, click the link below. We're here to help and happy to answer questions. That's what we're here for, is help people learn more about their health, educate them so that you can be dependent, you can be independent and take care of your health and take care of yourself. Thanks and have a great day.